Okay, we'll be discussing about the posterior abdominal wall. Can anybody tell me what do you understand by anterior or posterior abdominal walls? Like in thorax, you have also studied anterior thoracic wall, posterior thoracic wall. Exactly. So it's a boundary of a cavity. Sit down. So wall in case of posterior in the abdomen, posterior abdominal wall consists of some bones. And you have read about the anterior abdominal wall. So anterior abdominal wall was consisting of muscles. There was fascia, there was muscles, there was peritoneum. So in the posterior abdominal wall, you should know about what is the skeletal background of the posterior abdominal wall. So from this picture, it's very clear. It's a 12th rib attached to the T12 thoracic vertebra. So T12 thoracic vertebra, L1, L2, L3, L4, L5. That means lumbar vertebrae, one thoracic and all the lumbar vertebrae along with the one rib and the iliac crest. These are forming the skeletal framework for the posterior abdominal wall. If there is some skeletal framework, there will be some ligaments, there will be some fascia, and there will be muscles attached to it. So next to the skeletal framework, there is attachment of ligaments. So what are the ligaments? I guess you have already heard about the name of these ligaments. Iliolumbar ligament, anterior longitudinal ligament, ventral sacroiliac ligament. So anterior longitudinal ligament is a ligament that is extending in between the vertebral bodies. These are the anterior surface of the vertebral bodies. This green color ligament shown on the vertebral bodies, this is anterior longitudinal ligament. So in whole of the vertebra, anterior longitudinal ligament extends onto the vertebral body. Then you have iliolumbar ligament. Iliolumbar ligament that is extending from the ilium to the lumbar vertebrae. So this is the iliolumbar ligament, this one. And you have sacroiliac ligament, that means extending from the sacrum to the iliac crest. So this region was already told to you in the hip bone. So can anyone tell me what is the attachment of sacroiliac ligament in the hip bone? How many surfaces are there on the iliac bone? Have you seen auricular area on the hip bone? So what is the purpose of the auricular area? Auricular area किसके साथ articulate करता है? Sacrum के साथ. On the auricular roughened area, that is attachment to the sacroiliac ligament. You have ventral sacroiliac ligament and dorsal sacroiliac ligament. And then you have muscles that we will be discussing. So you have psoas major, quadratus lumborum, iliacus, and the fascia covering the iliacus, and psoas minor. You have already read about psoas major, iliacus, fascia iliaca, and the psoas minor muscles. So when we discussed about these muscles in lower limb. So this is the psoas major muscle. Can anybody tell me what is the attachment of psoas major? Lower limb तो complete हो चुका है. psoas major कहाँ पे insert होती है इतना बता दोगे? Lesser trochanter along with iliacus, that is iliopsoas. So this psoas major is extending from the transverse processes as well as from the adjoining area of the vertebra and the fibrous arches. So these green color are the fibrous arches. So all this area gives attachment to the psoas major muscle. Now these fibers, they turn down to reach the lesser trochanter. Now if they are reaching the lesser trochanter, if they contract, they will cause the What they will cause? Flexion. So they are the chief flexors of the thigh at the hip joint, and if they contract bilaterally, so you will be able to bend down. So your trunk will be bending down because of the flexion of the psoas major muscle bilaterally. Then it's a medial rotator of the thigh. Nerve supply to this muscle is the ventral rami of L1 to L4. Then the psoas fascia. Now the psoas fascia has several boundaries for the attachment, though it is covering the psoas muscle. So superiorly it is in the form of a thickened band. So this thickened band forms a medial arcuate ligament. In the diaphragm, you know, we have discussed about the medial arcuate ligament, lateral arcuate ligament. So this one attached to the L1 vertebra is the medial arcuate ligament. So the thickened and forms the medial arcuate ligament attached to the body of L1 and tip of L1 transverse process. Laterally, it is fused with the anterior layer of the thoracolumbar fascia. What is thoracolumbar fascia? thoracolumbar fascia कहाँ extend करता है? एंटीरियरली मिलेगा, पोस्टीरियरली मिलेगा? पोस्टीरियरली मिलेगा. एक्सटेंड कहाँ करेगा? thoracic region से lumbar region में. So it has different layers, the thoracolumbar fascia, anterior layer, middle layer and the posterior layer. Then the medially it is attached to the bodies of the lumbar vertebra and the intervertebral disc. So this is a fascia. Then inferiorly it is fused with the fascia covering the iliacus. So the fascia iliacus is the continuation of the psoas fascia, if you can say it in terms of, because it is getting inferiorly attached to the fascia iliaca. Then the psoas minor muscle. The psoas major muscle and the psoas minor, they have a different insertion. Psoas major was inserting on the lesser trochanter. This is inserting on the iliopubic eminence. Nerve supply for this muscle is only L1, ventral rami of L1. So origin is from T12 to L1. Then comes the quadratus lumborum. This quadratus lumborum, if you remember, it is forming the lateral arcuate ligament, and it is the lateral muscle of the posterior abdominal wall. So here is extending the quadratus lumborum. Quadratus lumborum was attached on the iliac crest. There is attachment of the quadratus lumborum on the iliac crest. So this region gives the origin or the proximal attachment for the quadratus lumborum, that is the iliolumbar ligament, then the part of the iliac crest and the lumbar vertebra transverse process. So which region of the iliac crest gives origin to the quadratus lumborum, ventral region or the dorsal region? We divide the iliac crest into ventral and the dorsal parts. Dorsally होगा, ventrally तो होगा नहीं, posteriorly होना है. So dorsally it gives attachment to the quadratus lumborum. Then it is inserted onto the inferior border of the 12th rib. So this is the 12th rib. Now if it is attaching onto the 12th rib and for the proximal attachment it is on the iliac crest, what would be the action of the quadratus lumborum? As it is attaching on the 12th rib, it will fix the 12th rib. It will fix the 12th rib during the inspiration. Now if there is bilateral contraction of the muscle, then it will cause the extension. Bilateral contraction of the psoas major was causing bilateral contraction is causing the flexion, forward bending, and the bilateral contraction of the quadratus lumborum is causing the extension of the spine. And if they act singly, that means on the right side and the left side separately if they act, then they will cause the lateral flexion of the lumbar vertebra. Nerve supply to this muscle is upper lumbar nerve and the subcostal. As this is the region of the subcostal nerve, so one subcostal nerve, that is T12, is supplying it along with the lumbar nerve. Coming to the last muscle, that is iliacus. So iliacus, you all know from where it is coming. इलियाकस तो बहुत इजी है, ये बोन में कहाँ से आती है, पूरा एरिया कवर करती है, बोलो. प्यूबिक सरफेस. और कुछ पर्टिकुलर टर्म? बिलो द इलियक क्रेस्ट बोलने की जरूरत ही नहीं है, अगर तुमने आइलिक फोसा बोल दिया, इट्स वेरी क्लियर. ठीक है, बैठ जाओ. So it's arising from the iliac fossa only from the upper 2/3 and rest of the iliac fossa is covered with the bursa. Insertion on the lesser trochanter along with the psoas major. Nerve supply for this nerve is femoral nerve. Till now it was the supply from the lumbar nerve, only this is supplied by the femoral nerve. Then action, it causes the flexion along with the psoas major. As the psoas major was causing flexion of the thigh, this is also causing the flexion of the thigh. So this is the iliac fossa where the iliacus muscle is covering and going to the lesser trochanter. Now the fascia iliaca or iliacus fascia. So iliacus fascia would be covering the muscle, that is iliacus muscle. So this is covering the whole of the muscle here. So you can see these. This is also forming the part of the femoral sheath. So posterior layer of the femoral sheath is derived from the fascia iliaca. So medially it is merging with the psoas major, or the that was covered with the psoas fascia, and inferiorly it passes down the inguinal ligament. When it is passing down the inguinal ligament, there is a formation of femoral sheath where it forms the posterior layer of the femoral sheath. Now there is a triangle, that is triangle of Marshall or lumbosacral triangle. So L5 is the level of this triangle. So what are the boundaries and what are the contents of the lumbosacral triangle? At the L5, the boundaries, medially it is bounded by the vertebral body of the L5 vertebra, laterally by the medial border of the psoas major. This is the psoas major muscle going down. So laterally it is formed by the medial border of the psoas major. Inferiorly this triangle is forming the border on the ala of the sacrum. So this, after L5 comes the sacrum. So this region would be the ala of the sacrum, lateral to the vertebral body of the sacrum. So this is ala of the sacrum, this is medial border of the L5 vertebral body, and laterally it is medial border of the psoas major muscle. Now on the floor what you will find, extending from the vertebral bodies are the transverse process. So laterally this triangle is present on the right and left side, so there will be extension of the transverse processes. So floor of the L5 vertebra, floor is formed by the transverse process of the L5 vertebra. Now if you see the contents of this triangle, and we start from medial to lateral. So first is, they are saying it is sympathetic trunk. So all the vertebral bodies in the paravertebral region, there is a chain that is running, that is sympathetic chain. So first content on the medial side would be the sympathetic trunk. Lateral to it another nerve is present, that is lumbosacral trunk. After that there is an artery, that is iliolumbar artery, and the obturator nerve. So these are the contents of the lumbosacral triangle. Now coming to the nerves of the posterior abdominal wall. So in this region, that is of the abdominal region, this posterior region will be occupied by which nerve? Lumbar region is there. So some nerves from the lumbar region and some from the sacral region would be present here. So lumbar plexus will be formed. How a plexus is formed and what is the purpose of formation of the plexus? When the nerve comes out of the intervertebral foramens, then how does it form the plexus? What are the branches that turn into the plexus? And are they giving the sensory supply or the motor supply to the region? अपर लिम्ब में भी प्लेक्सिस पढ़ा था ना, मोटर होता है, मोटर होता है. तो प्लेक्सिस फॉर्मेशन किससे होता है? नर्व के कौन से पार्ट से होता है? अगर इंटरवर्टिब्रल फोरामेन से स्पाइनल नर्व एग्जिट कर रही है, देन इट विल डिवाइड इनटू टू रेमाइज that are called as ventral and the dorsal rami. Purpose of dorsal rami? Cutaneous supply, that is the sensory supply. Ventral rami, they will form the plexus. So in the lumbar region, you have the lumbar plexus and the abdominal part of autonomic nervous system. So autonomic nervous system here is important because it is containing the sympathetic and the parasympathetic supply to the abdominal viscera. So sympathetic nerve, thoracic splanchnic nerve, lumbar splanchnic nerves are present. When the term splanchnic is used, it is for the viscera. Then the parasympathetic nerves are coming from the right and left vagal trunks. Last person who has just entered, stop using mobile. Okay, lumbar plexus, how they are formed, where they are present. So ventral rami we have discussed, plexus formation is by the ventral rami. So it is by L1, L2, L3 and the portion of L4. Not whole of the L4 nerve is going to contribute to the lumbar plexus, because some part of the L4 is going to form the lumbosacral trunk. So there is two terms, one is lumbar plexus, another is lumbosacral trunk. So they are different, don't confuse them, that they are same. So lumbar plexus are from L1, L2, L3 and L4. So what is the purpose of the lumbar plexus? You told me it is supplying the, giving the motor supply to the region. So it will be supplying the nerve muscles. So all the posterior abdominal muscles, they were supplied by the lumbar plexus. So now this is the formation of the lumbar plexus. This is the region of the intervertebral foramen. This is the vertebra, vertebral body, transverse process of the lumbar vertebra. Then this is the spinous process. So if I take out the vertebra above it, then I can see the intervertebral foramen. So this intervertebral foramen is giving the space for the spinal nerve to come out of the region. So when it is coming out, it is dividing into two rami. Now this lumbar plexus, they are going downwards and they give off some branches from the anterior and the posterior divisions of the lumbar L1, L2, L3 and L4. Then they descend downward through the psoas major muscle. Now what are the branches of the lumbar plexus? So here also we can see the branches: iliohypogastric nerve, ilioinguinal nerve, genitofemoral nerve, lateral cutaneous nerve of thigh. So these are coming out from the lumbar plexus. Now exactly what is their nerve what is their root value? This iliohypogastric nerve and ilioinguinal nerve, this is coming from the L1. So the root value for iliohypogastric and the ilioinguinal is L1. Spinal L1 is the root value for the iliohypogastric and ilioinguinal. Next is the genitofemoral. So genitofemoral is taking the fibers from the L1 as well as from the L2. So its root value is L1 and L2. Next comes the lateral femoral cutaneous nerve. Now these darker ones, these are the posterior branches, and this bluish one, they are the direct branches from the nerve. So this is the posterior division. This lateral femoral cutaneous nerve of thigh is getting branched from the L2 and the L3, and these are the posterior divisions. Like in the brachial plexus, you have ventral and the dorsal divisions that were forming the trunk. Then you have femoral nerve. Femoral nerve is derived from the L2, L3 and the L4 nerve. Ventral, these are the posterior divisions of these three spinal nerves. Then again comes the obturator nerve. Now the obturator nerve and the femoral nerve, they have the similar root value, L2, L3, L4. Only difference is Obturator is from the anterior division of L2, L3, L4, and femoral is from the posterior division of these spinal nerves. So you have to remember the lumbar plexus formation, the branches from the lumbar plexus. Now coming to the sympathetic and the parasympathetic nerve supply. So we have discussed that sympathetic nerve supply is going to give the visceral branches to the abdominal organs. Then it is giving some somatic branches to the lower abdominal wall and the lower limb. And the thoracic part of the sympathetic chain through the celiac plexus. Celiac plexus would be formed around the sympathetic nerve supply. जब भी होती है किसी न किसी artery के around plexus formation होता है. So celiac plexus are formed around the celiac trunk. So it is giving all the visceral branches to the abdominal organs. So pelvic organs will be supplied by the lumbar part of the sympathetic chain, and this abdominal organs will be having the sympathetic supply through the thoracic part of the sympathetic chain. And parasympathetic will be provided by the vagus and the pelvic splanchnic nerve. Vagal branches from the right vagal trunk and the left vagal trunk. Now what would be the effect of the sympathetic and the parasympathetic supply to the abdomen and the pelvic organs? If there is sympathetic nerve supply or sympathetic discharge, what will happen? Vasomotor. So vasomotor nerve supply means if you are in a situation where your sympathetic discharge is increasing, so vasomotor supply of this sympathetic region to the abdominal organs and pelvic organs will increase or decrease. Vasomotor supply means the vascular supply. So the muscle wall will be contracting. So lower blood supply will be given to the region of the abdomen and the pelvic viscera. Then motor to the sphincters. Will it allow peristalsis? No. So the motor sphincters, that means the esophageal sphincter, your this cardiac end sphincters and the pyloric sphincter, they all will contract. They won't relax. Then inhibitory to the peristalsis because the sphincters are in contraction. Then it carries the sensory fibers to all the viscera. So sympathetic has to carry the sensory fibers. So what would be the action for this? If it is carrying the sensory fibers to the abdominal and the visceral organs, sensations will be decreased. Then the sympathetic supply is also given to the suprarenal gland. I guess suprarenal gland has been discussed in your class. So what is present in the adrenal medulla? Sympathetic ganglia are present. क्या suprarenal gland नहीं हुआ है? किडनी हो गया? किडनी भी नहीं हुआ अभी. Okay, in the adrenal medulla we have the sympathetic ganglions which are not the postganglionic fibers. They are directly relaying into the adrenal medulla. So these sympathetic ganglia, they are the preganglionic fibers which are directly present, reaching up to the adrenal medulla. Now what would be the effect of the parasympathetic supply to the abdominal and the visceral organs? Relaxed ho, happy ho, then you have the parasympathetic nerve supply in your daily routine. So it stimulates peristalsis, inhibits the sphincter, so it is opposite of the sympathetic nerve supply. Then it is secretomotor to the gut and the glands. So it would be secretomotor because the secretions are necessary for the digestion and ingestion of the food. Then you have pelvic splanchnic nerve. Your pelvic splanchnic nerves will be present in the lower gut. That means in the anal region, in the rectum region, You have the pelvic splanchnic nerve that will be supplying the viscera, that is the large intestine in the lower part. So this completes the theory portion of the posterior abdominal wall. Your abdominal aorta and inferior vena cava has already been covered. So that was also included in the posterior abdominal wall. Then coming to the appendix and the relation of the appendix with the Schwarz measure. So appendix is located on the right side or left side? Right side. So if the position of the appendix is retrocecal, and in case it gets inflamed, if it gets inflamed, it will also inflame the Schwarz major muscle. So inflammation of the Schwarz major muscle causes the patient to keep his right thigh flexed. The Schwarz major action of the Schwarz major was when it is in contraction, it causes the flexion of the thigh. So the thigh of the patient will be in the flexed position and medially rotated. So these are the actions of the Schwarz major. So when Schwarz major is irritated, it is in contracted state and it is causing the right thigh flexion as well as the medial rotation of the thigh. So this would be the position of the patient when the patient will present to you. So this is the basis of the Schwarz test. Schwarz test we do when there is a patient who is coming to us with the appendicitis. Then you have Schwarz abscess. So abscess means pus collection. So if there is a pus collection in the vertebral column, this Schwarz descends downwards along the Schwarz major muscle. So when it passes down, it can present as a swelling in the groin because the Schwarz fascia was extending along with the fascia iliacus into the lower limb region, that is the region of the thigh. So if the patient is presenting with a swelling in the groin region, so this pus accumulation can be coming from the vertebral column. So this Schwarz abscess may present as a swelling in the groin region. And coming to the last one, myalgia paresthetica. So now here the lateral femoral cutaneous nerve. This is a nerve entrapment. So if this nerve is passing below the inguinal ligament here, so this causes the entrapment of the lateral femoral cutaneous nerve, leading to the pain in the region of the supply. So what is the region of the lateral cutaneous femoral nerve? Region of supply for this lateral femoral cutaneous nerve कहाँ supply करेगी?